Welcome to part two of motivational interviewing for healthcare professionals. Now we'll be talking about some of the postures, you might call it the principles or the very spirit of motivational interviewing. Now, patients will glean from our posture how we're feeling. So a lot of this is going to be kind of a style. And there are four, let's say, principles of motivational interviewing. The first principle of motivational interviewing is compassion. Compassion in that the patient or the client is in a position that they really don't want to be in. Just having that awareness, that keen sense that we're talking to somebody who really doesn't want to be stuck in their own circumstance. So compassion is the first principle of motivational interviewing. The second principle of motivational interviewing is acceptance. Now, we all have an idea of what our strengths are and what our weaknesses are. And when we're talking to our patients and clients, we will be better off if we have some acceptance and some understanding and awareness of this person's idea of what their strengths and their weaknesses are. And particularly not try to, especially early in the relationship, get into a back and forth, but just accept where patients are. And again, this is the spirit of motivational interviewing. The third principle of motivational interviewing is collaboration. How far can we go? Where can we go? Where would you like to go? Let's work together to get there. The spirit of collaboration. And then the final principle and fourth principle of motivational interviewing is evocation. Patients know exactly which direction they want to move in, but we can help them discover and find out exactly where they want to go by approaching them in really kind of a curious manner. And so evocation is kind of curious, and it's kind of a posture of, there's no limit to where we can go. Let's talk about where we can go and what you would like to see in your own future. So those principles, once again: compassion, acceptance, collaboration, and evocation. Those are the four principles of motivational interviewing. Now it's time to spend some moments discussing the critical practices of motivational interviewing. And there are four: engaging, focusing, evoking, and planning. Let's take them on one by one. Now, during most encounters, what we are doing is sitting down and getting to know our patients. That's the engaging part. And when we do this effectively, patients feel a sense of respect. They feel respected. They feel they have our attention. We have a wonderful rapport, and we can actually start from that point. And if we don't engage properly, well, then we might as well pack up and go home, because nothing else of significance can happen when we don't engage. So engaging is the first and foremost critical practice of motivational interviewing. Patients feel trusted. They trust us that we have their interests best at heart. So engage is number one. The second critical practice of motivational interviewing is focusing. Now, focusing is also called agenda mapping. Patients and our clients have sometimes multiple concerns, and we're aware of it. I mean, when I'm admitting somebody for a stroke, they generally have high blood pressure. They might have diabetes. I mean, they have many times multiple risk factors, multiple things that can require our attention. So agenda mapping or focusing has a lot to do with understanding from our patient's point of view and gaining from our patient's point of view what is it that they want us to focus on first. Now, in an acute setting, we can provide more sort of guidance and direction, and our patients depend on us for that. But in an outpatient setting, then we can glean from our patients, and we should ask them, what is it that we'd like to work on first and foremost? What are we going to focus on first and foremost? So agenda mapping or focusing has a lot to do with setting, let's say, a hierarchy of concerns. Now, the third critical practice of motivational interviewing is evoking. It happens to be one of my favorite, because in a sense, what we're doing is asking patients to use their imagination of where they want to go. And not just where, but how far they can imagine seeing themselves. Use your imagination. What would be ideal? What is your ideal blood pressure? What's ideal for you in terms of your body weight? Asking patients about what's ideal for them many times helps them to really think about something that they hadn't thought about before. So patients will start to ask you, "Well, I'm not sure. For my height, what is the ideal body weight?" And what you'll notice is when you evoke, what you actually start to elicit is change talk. Okay, so evoking is a very powerful way and a very critical practice of motivational interviewing. Now that we have engaged our patients and we have that mutual respect and that rapport that we built, and we have focused and we've got our agenda mapping going on, and we know what direction patients want to move in, and then we have evoked and we understand why patients want to move, and that's the key issue about evoking is understanding patients' why. Now all we need is a plan, and so the final critical practice of motivational interviewing is planning. If we're going to be pursuing a certain weight goal, are we going to be weighing daily or just once a week, or planning and having that discussion? Are we going to be achieving our goals by calorie counting, a point system? Are we going to be just avoiding carbs? I mean, what are we going to be doing? So that's the planning stage. So those are the 4 critical practices of motivational interviewing: engaging, focusing, evoking, and planning. We've been covering a great amount of ground in a short period of time. Now you understand the fundamentals of motivational interviewing and collaborating and having a conversation with patients to help them to access their own intrinsic strengths. Now it's time to move on to part 3 of motivational interviewing, in which we will talk about the tools of MI. Congratulations for completing part 2.